When you're dissatisfied with services received from the Health and Social Services Network in Quebec, and in the Estrie region in particular, well, it can be kind of hard to know how the complaint process works, who you should talk to, and what your rights are. So with that in mind, today we're going to be talking about how the CAAP Estrie can help you make your way through that process. Wherever you are, health and social service networks can be big, complex systems. And learning how to navigate our way through them in order to voice our concerns, our complaints, and our need for information can be a bit daunting. It can feel quite laborious. So we've invited Angela Moore to come and speak today. Now she's a complaints advisor with CAAP Estrie, and she's going to give us a great rundown, well you could call it a bit of a user's guide, on how CAAP Estrie can help you, as English speakers, make your way through the complaints process in the health and social service network in the area. Well, good morning, Angela, and welcome to About Townshippers.
Good morning, Ed. It's a pleasure to be here.
Hey, Angela, for English-speaking communities
Mhm.
in the Eastern Townships and in the Estrie region, getting access to all types of services is really important. And high on the list, of course, is getting access to health services. But we've got a fairly complicated, health system here in Quebec. And so with that in mind, what role does CAAP Estrie play?
Okay, so basically, we are a nonprofit organization. We're located in Sherbrooke, but we cover the whole Estrie region. So from Lake Meganic all the way to past Knowlton. It's just that whole region we cover. We're actually mandated by the law of health and social services. So it's written in the law that a nonprofit organization must exist to assist users in their complaint process. And since 2019, we've actually added another mandate as well, where we assist residents and owners as well in certified private residences for seniors.
Who can benefit from your services?
Everyone.
Okay, well, that's an
Absolutely
easy answer.
everyone, anyone who uses health and social services, anyone, for example, who has children or parents, or just anyone, if you feel you should have received services or have received services that are inadequate, we can assist you. So that basically covers anyone who's a user.
What's the difference between CAAP Estrie and, for example, SHU Users Committee?
So we get this question a lot because a lot of people are saying that we are quite similar, but we differ in very important ways. Our mandate is only for complaints, whereas the users committee, they have a broad mandate where they can cover many things. We are also external. Our funding comes from the minister. We are not part of the CIS. We are not part of the CIS if you're in another region that is not a CIS. We inform users of their rights, but we do not defend their rights. They have more grounds to make changes, whereas we have to wait on the user to make the changes. We also cover all different departments of the CIS. So for example, the SHIS Users Committee will only cover the SHIS and Hôtel-Dieu, whereas we can cover Hôtel-Dieu, the SHIS, the Saint Jeunesse, so the DPG, private residences for seniors, CHSLDs, like the whole thing.
So it really comes down to the inclusiveness aspect
Yeah, and
of
I
that.
I want to say, like, we're not saying one is better than the other. We work collaboratively with the users committee. We have a great relationship with them. In some instances, the users committee is actually better and more equipped for certain things, and in some instances, we're more equipped. So as we saw in one of your previous interviews, they discussed the parking situation at the hospitals. That's more of a users committee because it doesn't really touch on the services in the hospital. Another instance would be if you're having a stay in the hospital and you're not getting, for example, your meals on time. There's a certain delay if you make a complaint, whereas the users committee are on the floor. So it really depends on the need of the user.
Okay, well that's a perfect segue. What type of complaints? Maybe give us a couple of examples of some of the complaints that you get on a regular basis.
What's really fun about my job is it varies day to day. It really depends, the season, the day, the week of what the complaints come in. For English speakers, a common complaint I often get is the lack of English services, whether it be paperwork, whether it be having instructions given in English, different things like that. Another one I see often too is the lack of personnel and the fact that people are awaiting, different physiotherapy or seeing a doctor or things like that. It's the
Now is
lack
that bilingual personnel or just personnel in general?
personnel in general, but like I said before, for English speakers, a common complaint I often get is the lack of English services, whether it be paperwork, whether it be having instructions given in English, different things like that.
What would the general process be? Like walk us through. Okay, I'm a complainant. I want to make a complaint.
Okay.
So what would the process be right from the time I contact and how I would contact you, and what the steps are after that?
Okay.
Either for me as a complainant or you as someone that takes my complaint.
hmm So usually, in the case of a complaint, we really ask the user because, like I said before, we inform the users of the rights. We do not force them to do anything. We do not defend them. We do not say, well, they called about this complaint, I'm going to go report it, because it's not up to us to report. We just give the tools to the user. In your case, for instance, I would first ask the user if they want to do a verbal complaint or a written complaint, because there are well, it's about the same process, but two different ways of going about it. So in the case of a verbal one, I would just give you the phone number and allow you to speak to the Complaints and Service Quality Commissioner. They are the ones who investigate complaints for this use. So they would go into your file. They do that whole process. We do not have access to the CS files here. In your case, for example, if it's just the phone number, they would take your information, they would investigate it, and they would give you a verbal response back. Like I said before, some complaints are more complex. Some touch on many different institutions. They're very, especially medical complaints, they can get into a lot more details. You can also do written complaint, and the issue with that is some people have difficulty writing their emotions and their thoughts, and it could be a very stressful time. So we actually assist users in writing the letter. So we can have an interview with them, either talk about it over the phone or in person or by email, and go into detail about what happened, and then we compile it into a letter for them.
But
Afterwards,
it's done in their name or in your name?
in their name.
In their name. Okay.
There's always a consent form saying that we will be accompanying them, but at the end of the day, it's up to them to sign it and send it. And they can make changes to the letter as they wish, but it's really, we just help them put their thoughts together.
Okay. So I have a complaint. You guys help me put that into words and you
Mhm.
help me express that complaint to the forces that be.
Exactly. And then the
Okay.
forces that be, being the Complaints and Service Quality Commissioner, will take, they're mandated by the law to take 45 days. If in the 45 days they do not complete it, they have to notify you that it will take longer. For example, in the summer with vacation and whatnot, it might pass the 45 days. They have to inform you. Afterwards, um, you would receive a response if it's written, either written or verbal. Once again, the choice is up
Okay.
to the user. We do not influence them at all. We simply inform them. If they choose written, we will also receive a written response. So we will see how the commissioner responded to the user, and we can see with the user if they wish to go further or not.
I didn't think that's how it worked, but that's why we're doing the interview today. So we
Yeah,
can let people know
exactly.
how it, now, when it gets to the commissioner, do I receive service in English or in French
In
or
English.
it is in English?
Yes, and another thing that's important to note with the CAAP is we accompany you through the whole process. So for example, if the commissioner for whatever reason can't respond to you in English, I can actually accompany you in whether translating or overhearing the conversation, or just kind of having a witness sometimes to just hear the same thing that the user's hearing.
You clearly indicate that it's not a, okay, call them and our job is done.
No, 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 absolutely
Okay.
not. Even if, for example, people do a verbal complaint, if they wish to call us back after the 45 days and say, look, the commissioner answered me, I'm not happy with the response, what do I do? We still have their information. I don't just say, here's the number, you're not my problem anymore. That's not how it works at all. We really want to accompany and assist users to make sure the services get better in this use.
But you guys offer information sessions as well, do you not?
Yes, we do. We provide information for organizations. Even if people want to call us and say, I have this question about this situation, what can I do? They can absolutely call us. Another thing too, a lot of people that we realize is happening is they'll make a complaint without our assistance, because you can make it on your own. You don't necessarily need us. They'll realize once they get the conclusion that they could have had our services, call us after the fact and ask if they can go with us to the Quebec Ombudsman or the revision committee if it's a medical complaint.
Okay, now I'm looking for a bit of inside scoop here. In
Yeah.
your professional, in your professional, subjective,
Mhm.
objective opinion,
Mhm.
I have a choice. I can complain by myself. I can
Mhm.
make a complaint if I find the right channel, or I could get your support.
Mhm.
Which complaint is going to go farther?
It doesn't make a difference.
Okay.
However, when people contact our services, we can really make sure that they have all the detail. The commissioner has all the details necessary to properly investigate the complaint.
Ah, okay.
So for example, if I want to make a complaint about a nurse and I just call them up and say, I had a bad service with this nurse at, a CLSC last year, versus there was a nurse who, came to my house on this date last year in Sherbrooke. There's, you know, two different ways we can look at this. They'll still investigate both, but if they have more details, they'll be able to go more in depth. And another thing too that we see often is, for example, a child calling for their parents in a parent in a CHSLD. They'll make a complaint, but the complaint will be refused. And oftentimes they're wondering, why was it refused? And we're able to look at why. Maybe it's because that person's not the power of attorney. Maybe because there wasn't enough, it wasn't clear enough what the motive was in the complaint. There's different things we can look at with them to make it accepted at the complaint commissioner.
That's really interesting. So it's really, did you think of this? Did you think of this? Don't
Mhm.
forget this. And okay, that's
Exactly. And
understandably a benefit.
even if they do decide to call us and say, look, we got all the information we need, we'd like to go on our own, they can go absolutely on their own. We're, like I said, we're not there to force people to use our services. We're really there to help people with the main goal in mind to make services better for every user of, health and social services.
With emphasis on English users, right?
Yeah,
Or
especially me specifically, I was hired for the English speakers of the townships. I was hired approximately 4 years ago, and it was the main goal to get our information out to English users because, first of all, many, even French people, do not know of us, let alone the English speaking, users out there to know that there is help out there. All you need to do is make either a quick phone call or a quick email, and we're here to help you, even with what you might think is a silly question. We're really here to help. And definitely, like, all our services are free, professional, like we're really specialized in the complaint process and users' rights. We're confidential, so no one will know, first of all, that you called. Second of all, even if you called and we call back and leave a message, it's still confidential information. We're not going to say, yeah, so it's about the complaint you wanted to do about the
okay.
residence you're currently living in. We don't do that. We'll just say it's, Angela Moore, just give me a call back. And all our services are bilingual. Even when you write a complaint to the commissioner, it can be done in English. We can translate it if you wanted to translate it in French, but really all our services are bilingual. Information sessions are bilingual, where we really want to make sure that the services are out there.
Wow, I'm glad we had a chat. I've just learned a whole bunch of new things about like Angela Moore, you're the complaints advisor and promotional agent for CAAP Estrie. This is going to be really, really useful. This is the type of information that English speakers need.
Exactly.
And so thanks for all the good work you do. And thanks for taking the
Very
time
well.
to speak with us today.
It was my pleasure, honestly. And there are CAAPs in every region in Quebec. So even if, for example, someone listening to this is not sure if they qualify as the townships, I'll leave the toll-free number and they can call. And like I said, if they have any questions whatsoever, we're here to really answer them and give them the proper information.
You know, you should do infomercials.
Thank
You're
you.
really good. Well, look, as I like to end off the interviews, you go off and misbehave, and we'll talk to you again soon.
Definitely, definitely.
Take care.
You too.
If you'd like more information on CAAP Estrie, if you'd like to contact them and get to know their services a bit more, well, all the important details are right down here in the video description. And I'd like to thank you for spending a bit of your time with us today. If you've enjoyed this episode, if you enjoy the web series, well, please share and like, because it helps us improve the series, and it also helps us spread the information through the English communities of the townships. And you can also subscribe to Townshippers Association's YouTube channel. My name is Ed Humphrey. This is About Townshippers, and we'll see you next time.